As reported by the Institute of Medicine, preventable medical errors result in injury or death, and patient safety initiatives are essential to the reduction of these inherent risks. This week's discussion of risk anticipation is important in helping to identify, evaluate, and work to reduce risk and improve patient safety and outcomes in the microsystem. Quality is the degree to which health services for an individual and population increase the likelihood of desired health outcomes and are consistent with professional knowledge. Safety exists when errors and patient injuries are prevented, and risk is measured in terms of the probability of error or adverse events occurring and how significant the impact of this event is to the patient and organization. Quality, safety, and risk intersect in the microsystem, and the C&L role is to help identify risk in terms of safety and quality of care delivery, and is one of the essentials of the C&L role. Patient safety is freedom from accidental injury and should be a condition that is present when the patient enters the healthcare system. Creation of an environment of patient safety requires risk assessment, process improvement, tracking of near misses and medical error, and immediately responding to those errors. Your textbook provides important definitions related to risk anticipation. We identify errors through many means, and we use these means to help us identify the underlying cause of those errors and how we can prevent them in the future. This requires a system approach to error. Because multiple factors result in errors, individuals are not solely responsible, and blame and punishment prevent true causes of error from being discovered. Creation of a just culture is an important part of the risk management process, because individual factors and system factors coexist and interact to create reliable and safe practice. One way to approach through a system approach to causality is the Swiss cheese model, where you can see that many different gaps in the process can result in an error occurring. So we look at the work conditions, the human conditions, and the organizational conditions, each of which may have a gap that work together to cause an error to reach the patient. Risk management is a process by which vulnerabilities are identified and changes are made to minimize the consequences of any adverse patient outcomes and liability. Risk management requires a commitment to patient safety and is everyone's responsibility. While we think of litigation, malpractice, and blame when we think of risk management, the processes of identifying potential risk or reviewing an error for root cause are important parts of that process. In the past, we did focus on the reduction of liability to the organization or individual, but currently we're looking at quality improvement of the microsystem and a culture of just culture. And we identify and manage risk by standardizing our processes and introduce those processes that are capable of helping us reduce risk of error and adverse outcomes. Most errors occur in the categories of patient identification or clinical competency. And as you look at these lists, you can see that we track many of these risk and errors in our current healthcare system and look for ways to reduce the risk of these errors occurring. This requires leadership to approach risk management through a just culture and to set expectations, educate the staff, build accountability through outcome measurement, encourage feedback, and coach and provide leadership that supports a just culture. The risk management process includes reviewing policies, standards, and protocols, looking at the current standards of cares, and comparing how those standards match what's happening in the organization. Use of incident reports, claims management, and understanding regulatory and accreditation requirements are also part of the risk management process. There are two ways to approach error reduction. One is to look at the root cause of an error after it occurs, the specific true underlying cause of that incident, and the cause is under the control of management to be fixed. In other words, we can fix this process in order to prevent that error from occurring again. A root cause analysis is reactive. It occurs after the fact of the error occurring and is a systematic process. There are several tools that can be used, and it requires patience and focus. The tips for a successful root cause analysis include: one, bringing all the people to the table whose departments were involved in the error, and to identify the underlying causes and to address all those causes with a recommendation for how to improve. Being open-minded, not taking a blaming or symptom approach, looking at it from a just culture approach, and focusing on the goal of finding the true cause are important steps to the root cause analysis process, which begins with data collection, brainstorming, developing contributing factor statements, and recommendations, and how are you going to measure it, an outcome measurement. You ask what happened, how did it happen, why did it happen, what can be done to prevent it from happening again, and use several different tools, including cause and effect diagrams, histograms, flow diagrams for the process, and other types of tools that can be used to help you identify the frequency of the problem, how often it's occurring, and the severity of the outcomes. You look at all the contributing causes and you answer why did it happen at each step of that diagrammed event. And your statement criteria must reduce the likelihood that that event's going to occur again if your action is corrected. The rules of causation: you must clearly see the cause and effect relationship between the events of the error, and you must be able to identify what happened that was not a human error, and the preceding cause of any procedure violations is what happened that caused that procedure to be violated. When you're looking at recommendations, do the actions address that root cause, and are the recommendations specific and concrete? Can somebody from outside the process understand and implement these recommendations? And once you've implemented them, have you identified how you're going to measure any outcomes that result down the road? Do you have sampling strategies and a time frame of measurement identified? And is the performance threshold realistic? 100% fall prevention is a great goal, but is it really realistic to identify that no one else will fall on the unit? Remember, each problem is an opportunity for performance and quality improvement. The failure mode and effects analysis process is proactive and prospective. It is an approach that looks at how can we prevent an error from happening, rather than the root cause analysis reactive approach, which means the event has already occurred. So looking at failure mode means we're looking proactively to say, what could be a problem on this unit and how can we prevent that problem from occurring? Failure mode is the ways a process can fail. So how can it fail? What are the potential errors that will occur? How can we make the intended function to work well? And what root cause could be the cause of a failure that we can fix? Effectively eliminating barriers to a process helps us to prevent the likelihood of that error occurring. A hazard analysis is a collection and evaluation of the information about any hazards that are associated with the process and include those that are most likely to cause the illness or injury if they're not controlled. You must assemble a team, describe the process, and conduct a hazard analysis. And use a flow diagram, number the steps. Remember, think what is actually occurring, not what does the policy say we're going to do, but what are we actually doing on the unit right now. And that way, as you understand any gaps that are happening between what you're supposed to do and what's actually occurring, you can address those gaps in care and prevent an error from occurring. Listing all those possible failures that may happen at each step of the process and ranking the severity of that failure to cause an error is important part of this process. Then you must design the new process by eliminating the steps most likely to cause failure and include steps that make it easier to follow the correct process, identifying any points where an action can be taken to prevent a failure that impacts the patients. Identify outcome measures for evaluation of the effectiveness of the process, and identify who's going to be responsible for making sure the recommendations are implemented, making also sure that management has approved implementing these recommendations. Then you need to also identify how you are going to evaluate, who's going to collect the data. So you need to look at it as quality improvement, knowing that it's going to be time consuming and that the process is only as good as the team that you've assembled together. One way to avoid failure is to always include individuals who are directly involved in the process and avoiding letting that process be your full-time job. You must also not confuse the root cause approach, which is the after the error has occurred, with the failure mode approach, which is a prospective process. There are several principles of patient safety listed here, and importantly, we need to listen to what our patients say about safety and base our process designs on any human factor principles like ergonomics and usability. I hope this has helped you to understand a little bit about the risk anticipation process. Your textbook readings and other assigned readings will help you to further understand the importance of the role of the CNL in risk management and risk anticipation.